Hello, I'm Greg Sattler.
And I'm Mia Landon, and we're going to talk a little bit about Cri-du-Chat. So, Cri-du-Chat is a genetic disorder that's caused by a deletion or a translocation on the short arm of chromosome 5. It was discovered in 1963 by Jerome Lejeune, who was a French pediatrician. He was in the middle of Down syndrome research at the time, however, and so it was not until almost 10 years later that they began more extensive study of the genes affected. Cri-du-Chat is a rare disorder affecting between 1 in 20,000 to 1 in 50,000 newborns. It can be caused by either a deletion or a translocation. So in the case of a deletion, it occurs randomly due to unequal recombination during meiosis, which most typically occurs in the father's sperm. In the case of a translocation, the mutation is inherited from an unaffected parent. However, this is exceedingly rare.
So, Cri-du-Chat is considered a spectrum disorder, meaning that it can be expressed on a mild to severe scale depending upon the size and location of the deletion. This figure shows the short arm of chromosome 5 mapped according to the symptoms caused by a deletion of their respective genes. So, for example, a patient who has a deletion within the 15.2 to 15.3 range would not display the severe mental retardation and microcephaly of a patient whose deletion spanned from 13 to 15.3. Some of the most common physical symptoms are listed here with their percentage of prevalence. These include abnormal dermatoglyphics, meaning the simian crease extends all the way across the palm, micrognathia, they have small jaws, the typical cat-like cry, a low average birth weight, microcephaly, they have a smaller than average head circumference, abnormal epicanthal folds in the corners of their eyes, large nasal bridges, hypertelorism, meaning they have wide-set eyes, downward turned corners of the mouth, round face, and low-set, abnormally shaped ears. There are some other symptoms which typically develop later in life, such as the face becomes longer and narrower, the supraorbital arches become more prominent, the philtrum becomes shorter, the lower lip becomes more full, dental malocclusion develops, palpebral fissures become more horizontal, divergent strabismus or cross-eyedness is very common, shortened metatarsi and metacarpi result in them having small hands and feet.
So, while Cri-du-Chat can only be verified through a blood test, it's really important to first be able to recognize some of the common symptoms that indicate this disorder. So, the most obvious is the cat-like cry. It's what the disorder was named for. It's caused by abnormal larynx development, but typically it disappears after age 2. They also tend to have a simian crease, which is just the horizontal line continues all the way across the palm. And microcephaly, so at birth and throughout their adult lives, their head is smaller than average in circumference. Hypertelorism, so they have the wide set eyes, and that also attributes to a wide nasal bridge. And then they also tend to have abnormal epicanthal folds in the corner of their eyes.
So if a doctor believes that Cri-du-Chat is responsible, they should order a blood sample, and the first test to run on this would be a karyotype analysis in order to try to visualize the deletion. And then to further verify this, they should run a secondary test using a FISH analysis. This stands for fluorescence in situ hybridization. This is kind of similar to a southern blot. FISH uses a single-stranded DNA complementary probes that are labeled with a fluorescent dye in order to locate the desired genes on the chromosome.
All right, while there is no cure, there are several therapeutic treatment options that can help manage the effects of this disorder. Those include occupational therapy, physical therapy, speech therapy, and a few alternative therapies. So, occupational therapy helps patients refine those fine motor skills that are necessary for their everyday basic self-care. Those can include brushing their hair, getting dressed, and feeding themselves. At the same time, it also helps improve their relatability to the world around them and that they can perceive outside inputs and respond to them more appropriately. Physical therapy helps improve coordination and build up muscular strength in order to teach them to sit, stand, walk, run, etc. Speech therapy helps patients overcome physical abnormalities of the larynx that are associated with the disorder. It does that through speech exercises as well as helping them to overcome their mental disabilities and develop stronger verbal communication through various learning techniques. There are a few other alternative therapies. Those include aromatherapy, aquatic therapy, which helps in building up their muscles some more, hippotherapy, which uses the movements of a horse to provide a steady source of motor and sensory input, and music therapy.
So the general prognosis for Cri-du-Chat patients is that they can expect to have a normal lifespan. And during this lifespan, through various therapies, they can learn to care for their basic needs in everyday life. And they can also develop relatability and communication skills, which are needed to maintain relationships with people around them. Thank you very much.